J.A. is a 50-year-old man presenting to the emergency room with anxiety, hypersalivation, and paresthesia. Para meaning deviation, like how it's used in paranormal, and esthesia meaning feeling. A deviated feeling. In this case, he had a horrible burning sensation in his forearms, but nothing was burned there. He can't speak to the admitting nurse. He has a hard time forming words. He's foaming at the mouth. His neck muscles are rigid, and clearly, something is wrong with his brain. For 15 years, J.A. had been taking an herbal supplement for general health. These tablets fixed his breathing problems, he thought, and he took these at least 3 times a week, every week. 3 years ago, J.A. presented to the emergency room because something was wrong. He was dizzy and constantly out of breath, and a blood test found out why. His kidneys had completely shut down. This isn't surprising given the supplement that he had been taking for 12 years. The active ingredient herb is from a family called Aristolochiaceae. Ancient herbal wisdom may have known this to be a very take-sparingly remedy, or better yet, just topical, skin only. You probably weren't supposed to take it long-term, or even really put it inside of your body in the first place, because it has aristolochic acid. This is nephrotoxic, nephro referring to the kidneys, explaining why J.A.'s kidneys were shutting down. Aristolochic acid inserts itself into kidney cell DNA. It turns the kidneys into a stiff, fibrous shell incapable of functioning normally, explaining J.A.'s kidney failure. But doctors didn't know he had been taking this supplement. He didn't tell them that because he didn't think anything of it. It was such a minor detail of his everyday life, he never gave it a second thought. Doctors start him on dialysis. This is hooking him up to a machine so that it can filter his blood for him. This will remove the wastes that should have been taken care of by his kidneys. If those wastes build up in his body, they can rot his body from the inside and very quickly shut down his heart and end everything. But this is a temporary fix while they wait for a kidney transplant. He has to go to dialysis multiple times a week. 3 years pass. J.A.'s day finally arrives. A kidney is available. In rural Idaho, a middle-aged man was found unresponsive in his bed. His heart had stopped beating. His family was able to find him just in time for paramedics to arrive and resuscitate him. But it wasn't in time to actually save him. At the hospital, he never regained consciousness. He was declared brain dead. On hospital day 5, that man was removed from life support. His organs were recovered and prepared, and his left kidney was determined to be a match for J.A. At a hospital in Ohio, the medical team prepares J.A. It's time for the kidney transplant. Just 1 kidney. It'll be enough that he won't need dialysis anymore, at least for now. Surgery's done, and J.A. seems to recover nicely. The transplanted kidney is called a graft. J.A. is the host. The immune system attacks things that aren't supposed to be in the body. If J.A. just got a new organ, then the immune system will think that that organ isn't supposed to be there. The immune system will attack that organ and destroy it while setting off a massive inflammatory reaction inside J.A.'s body if nothing is done. This organ rejection is called graft versus host disease, but we can do something about this. Medicines were given to suppress J.A.'s immune system. 3 of them do 3 different things. First, steroids. They decrease white blood cells. They decrease signals that kick off the immune system. Second, another specialized medicine goes into the white blood cells and stops their genes from producing immune signal molecules. Third, a final medicine stops white blood cells from replicating. It doesn't destroy them, it just stops them from becoming too numerous. This ensures that the kidney has time to acclimate inside J.A.'s body, that blood vessels can regrow to that kidney, and that his body can recover well. On the flip side, this triplet neuters the immune system and predisposes him to infections, including ones you're not supposed to have in immunocompetent people. But everything seems great. A few weeks pass. J.A. is feeling excellent and recovering well. But 5 weeks after the transplant, something was wrong. Hey, quick question. Have you learned a couple things from this video so far? If you have, and you aren't subscribed yet, I'd appreciate it if you did subscribe and come back to see the video that I publish next month too. I make these videos for fun, and I do them to teach people about medicine and to show how we think in the hospital. I've made on average 1 video a month every month since 2017, and it's my fun time hobby. Making them is the highlight of my day, so I'm just so happy to be able to share them with you. Appreciate you. One evening, J.A. felt a burning sensation in his elbows. It would pulsate into a pins and needles feeling into his hands. When he got up from his chair, a pain shot up his leg and he collapsed to the floor. At the toilet, J.A. tried to urinate, but he just couldn't. The feeling was there. The urge was present, but it was like he was in a public bathroom with a giant line waiting behind him, and the pee fright was too intense. He started becoming disoriented to time and place. When everything started making sense again, he noticed that he was shaking. At his computer, J.A. had poured himself a glass of water to take his medicine. When he tried to drink, he suddenly choked. It just didn't go down the right way for some reason. On the floor, gasping for air, water had gotten into his lungs. He couldn't stop coughing. Anytime he even brought a glass of water to his face, he'd have an overwhelming gagging sensation. When he'd force himself to sip the water, he would shake uncontrollably. The water, cupped in his mouth, would spill out, and he'd gasp for air, unable to swallow the water or breathe until finally, he'd spit it out. He needed to drink the water because he needed to take his immunosuppressant medicines, but finally, he just totally gave up and stopped taking them. One morning, J.A. was found on the floor in the bathroom, shaking and screaming, his neck jerking in unnatural ways so shocking to his wife that she calls for 911 and he's brought to the emergency room where we are now. At examination, doctors find a J.A. with fever, stiff neck, agitation, and paresthesia. The brain is involved, the nerves are involved, and fever indicates an inflammatory process. So, if he's on immunosuppressants because he's 5 weeks post-kidney transplant, then everything put together points to meningitis. Itis meaning an inflammation of the meninges, the membrane covering the brain and the spinal cord. Neck stiffness is a telltale sign. The fever is the immune system trying to react to a pathogen that got through because the immune system was getting held down to protect his transplanted kidney. There's one way for them to tell if this is meningitis. The brain and the spinal cord are surrounded by cerebrospinal fluid, CSF. In meningitis, this fluid will be infected. It might have protein and sugar floating around in it. Doctors stick a needle in his back to collect a sample of this fluid, but there's a problem. It'll take about a day to grow out detectable amounts of bacteria or fungus from it. If they wait for the results to come back before giving him treatment, a whole day's worth of pathogen could grow. And that could be life or death, but there can be other signals. When they look at the fluid, it wasn't cloudy. Analysis didn't show abnormal amounts of protein or glucose. It all seemed normal. An MRI shows that something is happening. It's not normal, but it's also not clear what it is. It does kind of look like it could be a viral infection, if anything. Given all of this information, J.A. is started on antiviral medicine and empiric antibiotics, doing nothing, while all the evidence points to something is life-threatening, especially at a time like this when every second counts. But something else entirely was going on. On the second day in the hospital, J.A. was found in his bed, choking on his own spit. When he tried to cough, he would choke again. At times, he'd shake violently in bed, but then he became unresponsive. Doctors sedate him and put a tube down his throat to protect his airway and so that a machine can breathe for him. When they look at the test results for the bacteria and fungus from his cerebrospinal fluid, they found out this isn't meningitis. So, what could it be? Doctors had written a problem list. They need to reason out why each one is not the problem and figure out from there. Now that it's not meningitis, it narrows down the list. J.A.'s problem started 7 days ago. This pace is important. If he deteriorated like this in 7 seconds instead of 7 days, he'd have a completely different problem. 7 seconds usually means some kind of blood vessel problem, like a clot blocking flow or a bleed. If it took 7 years, that's a different problem in the opposite direction. It could be neurodegenerative, like amyotrophic lateral sclerosis, ALS, or it could be a tumor. But the MRI didn't show a tumor. There was no brain bleed. This means he has an infection, but which one? Tetanus causes muscle spasms. These can make it impossible to swallow, but tetanus doesn't usually cause an altered mental state. Diphtheria is caused by a bacterial toxin that strips off myelin sheath from nerves. It can cause problems swallowing, but it also makes it so that patients have trouble moving their eyes, their tongue, their face can start to droop. None of those happening to J.A. Botulism is also caused by a bacterial toxin, but it paralyzes the patient, and J.A. isn't paralyzed, leaving one final infection to be the possible problem. Rabies is an infection. It's from a virus. Patients are first incubated after contact with rabid animal saliva. That saliva has to get into the body, so it's from a bite or a scratch that breaks skin. And then the virus settles for weeks, and then the prodrome appears. Pro here meaning early, and drome from Greek referring to road or path down which one is headed. This is the early set of symptoms that worsen as the patient descends into the acute neurologic phase, followed by coma, and then the end. J.A.'s extreme aversion to water, dubbed as hydrophobia, is unique to rabies. The other infections don't usually cause this. His other symptoms were all consistent with rabies too, but there's a problem. J.A. never came into contact with any animals. He didn't have pets, he didn't go outdoors. Prior to transplant, he was sitting in dialysis for several hours, several days a week, and post-transplant, he didn't leave the house either. Human rabies is extremely rare in the whole United States. Just 125 cases had been reported in the 58 years from 1960 to 2018. So, how did he get it? Doctors contacted the Ohio Department of Health and Centers for Disease Control, and very quickly, J.A.'s saliva, his blood, his CSF, and other bodily samples were collected and sent to the CDC. Rabies virus RNA was detected in his saliva and his CSF, confirming rabies. When they sequenced the viral genome, they determined the rabies that J.A. had was from a silver-haired bat. But when public health officials interviewed J.A.'s family, they confirmed J.A. never had any contact with any bats or any other animal. So where did this virus come from? Health officials looked at J.A.'s medical record. His only contact from the outside world that broke his skin was the transplanted kidney. They traced back to the kidney donor in Idaho. They pulled up his medical record, no mention of rabies, but he was a middle-aged man who just suddenly died in his bed. Why did that happen? Idaho Department of Health and Welfare went to the donor family to interview them, and this is where they found out everything. In December 2024, just days before he suddenly died in bed, the organ donor in Idaho suddenly became confused with difficulty swallowing and walking, hallucinations, and he had a stiff neck, just like J.A. did. 5 weeks before, in late October, the man was outside his house with a kitten. A skunk had approached them. Its body language was in a way that it was going to attack. The man kicked the skunk to protect the kitten, but it fought back until it fell unconscious. But it had scratched the man's shin in the encounter and drew some blood. The man was pretty sure it was only a scratch, not a bite, but the fact that it broke skin is a cause for concern. It's just that he didn't know it at the time, and this is what started this tragedy. Rabid animals will hypersalivate. Virus is in the saliva, either from a bite or a scratch. Because these animals lick their claws, the infected saliva can make its way into human bodies when skin is broken. Rabies virus replicates in muscle cells at the site of inoculation. At the neuromuscular junction where nerves connect to the muscles, the virus gains access into the nerves. They migrate a few inches every day until they reach the spinal cord, where they start moving towards the brain. This period is the incubation and prodromal stage where bad things start to happen. In the spinal cord, virus moves very quickly. It gets to the brain, and then, very quickly, it spreads out widely through the nerves. In highly innervated places like the salivary glands, viral replication explodes. Viral shedding gets all over the body. The damage that rabies physically does to the brain appears mild when compared to other diseases, at least from what we know at the moment. By the time the medical team did the brain MRI for J.A., the diffuse, inconclusive finding may have been the rabies already there, causing dysfunction rather than brain death. And when rabies spreads, should that person become an organ donor after it's over, that virus will make its way into the organ recipient's body, infecting them too. The reason this is particularly scary is that neither the patient nor the medical team knows rabies is even involved at all until it's too late. The donor, who was previously healthy, died suddenly with nothing on their medical record. By the time the organ recipient develops symptoms, viruses are already in the brain, spread throughout the body, and the medical team will have wasted time ruling out the most obvious problems caused by complications post-organ transplant. This was a chain reaction of unfortunate events culminating in the final disaster. Health authorities tested a sample of what was left of the organ donor's right kidney and detected rabies virus RNA consistent with the silver-haired bat rabies variant, consistent with the one found in J.A., explaining how J.A. got it. How do you treat something like this? Time matters. When the kidney donor got the skunk scratch, he had just a window of days where he could have gotten it checked out and received post-exposure prophylaxis. There's two medicines here. The first is antibodies that neutralize the virus, and the second tells the body to produce even more of those antibodies so that viruses that have already replicated can be neutralized, and that the body can continue to neutralize viruses for years afterwards. When health authorities tested serum samples from the organ donor that were collected when he presented to the hospital before he died, they found out he didn't have any rabies virus antibodies. This confirms his family's statement that he didn't seek out any treatment after the skunk encounter. But it also tells us that his body didn't have enough time to, or wasn't able to, react to this infection. But J.A. is still alive right now. Is there anything that can be done for him? In the hospital, blood tests find that J.A.'s body has produced rabies antibodies. However, by the time he presented to the emergency room, his disease had become so advanced, virus had replicated all throughout his nervous system and the rest of his body. It had come in from the transplanted kidney, traveled through the nerves, got into his spinal cord, and from there reached his brain, the nerves sending signals from his brainstem to his heart, quickly becoming dysfunctional because of the virus. His advanced presentation, conflated by a difficult diagnosis in a disease that doesn't have much treatment this late in the course of illness, made it difficult for the medical team to do much more outside of supportive care. But J.A.'s case wasn't the only exposure. Public health officials found out multiple people received cornea tissue from the eye from the donor in Idaho. 3 patients, one each from California, Idaho, and New Mexico, were recipients. This too can transmit rabies. These patients were tracked down, the grafts were removed, and post-exposure prophylactic therapy were given to them. A 4th patient in Missouri had corneal transplants scheduled from this donor, but luckily, health authorities were able to stop it in time. The healthcare workers who came into contact with J.A., who came into contact with the Idaho donor, and who came into contact with the 3 cornea recipients were also identified and given post-exposure prophylactic therapy. The unfortunate part about the situation is that it isn't the first time it's happened in the United States. In 2004, doctors at a hospital in Texas diagnosed 3 organ transplant patients who got encephalitis. A 4th patient was also diagnosed after receiving part of a blood vessel during a liver transplant. All 4 patients became progressively obtunded and lapsed into coma and then died within 50 days of their transplant. At the time the patients expired, doctors were stumped. When they did their diagnostic tests, everything was ruled out. They asked the CDC and the Texas Department of State Health Services for help because these all happened at the same place. This means that there could have been some kind of outbreak happening, and when investigators looked, they found out all 4 patients had received organs from the same donor, and that donor had contracted rabies. When he died, there were no mention of rabies in his medical record, but they detected rabies virus RNA in his body when they tested for it, and the organ recipients who died had the exact same rabies virus RNA in their bodies too. In countries where rabies is more common, this situation of infection from organ transplant is more well known, and J.A. would have the same experience as these other rabies-infected organ recipients. On hospital day 7, J.A.'s heart stopped beating. Doctors rushed into his room to try to resuscitate him, but no matter what medicines they gave him and the CPR, they weren't able to resuscitate him. At autopsy, his brain samples were sent to the CDC. Confirmation of his rabies diagnosis by the CDC laboratory happened after he passed away. By the time he presented to the emergency room, the disease was so advanced and the virus had spread so deep, he only had a few days left. Investigators sequenced the RNA they found in J.A.'s samples and found out it was from the same silver-haired bat variant as was found in the Idaho kidney donor's body. They determined that a bat infected the skunk. The rabid skunk scratched the donor, infecting him, and then his organ donation subsequently infected J.A., and J.A., being someone post-transplant, didn't go outside, didn't interact with animals, was on immunosuppressants, could have had a variety of other, more obvious infections and related issues, but instead, it was the one infection that no one was thinking of at the time. After his case was published in December 2025, CDC had already been examining guidance on what to do so that this doesn't happen again. There isn't anything standard right now, but they want to raise awareness, especially in the situation where an organ donor had acute encephalopathy when they died. It's really important for the medical team to gather a proper history. So while they figure that part out, what can you do? The first is, if you're in America, don't panic, because this is rare. But if you are in a place where there's rabies-susceptible animals, bats, raccoons, skunks, fox, coyote, and if you're in Asia or Africa, it'll mostly be dogs, you want to make sure that you get post-exposure prophylaxis therapy. This really even goes for something like Americans who go camping in places where there might be bats and you're sleeping without a tent or any covering over your entire body. Rabies prophylaxis is a medical urgency and not an emergency. You have a few days to get it after any possible exposure, but please keep in mind, it's days. It's not months, it's not years, it's days. And if you or a family member might be getting an organ, you might want to ask if they checked about the donor having acute encephalopathy at the time just before they transition to the state whereby they would give that organ to you. Thanks so much for watching. Take care of yourself and be well.